Imagine this. Right now, your heart is beating quietly inside your chest, about 100,000 times today, pumping oxygen-rich blood to every cell in your body. But what if, suddenly, that blood flow stops? What happens inside your body during a heart attack? Today we're going inside your chest to uncover exactly what happens, step by step. What is a heart attack? A heart attack, medically called a myocardial infarction, happens when blood flow to a part of the heart muscle becomes blocked. Your heart is a muscle, and like every muscle, it needs oxygen to survive. Oxygen is delivered through special blood vessels called coronary arteries. If one of those arteries becomes blocked, the heart muscle begins to suffocate. How the blockage forms? Inside your arteries, fatty deposits called plaque can slowly build up over years. This condition is called atherosclerosis. Most people don't feel anything while this is happening, but one day, that plaque can suddenly rupture. When it breaks open, your body thinks there's an injury. It responds by forming a blood clot. If the clot becomes large enough, it completely blocks the artery. Now oxygen can't reach that part of the heart. The clock starts ticking, the first minutes. Within seconds of blockage, oxygen levels drop. Heart cells switch to emergency mode. They begin producing energy without oxygen. But this produces acid. Pain signals travel through nerves to the brain. This is why people feel chest pressure, tightness pain spreading to the arm or jaw after 20 to 40 minutes without oxygen. Heart cells begin to die. This damage can become permanent. What the body tries to do. Your body doesn't give up easily. It tries to increase heart rate, redirect blood flow, release stress hormones like adrenaline. But if the blockage remains, the damaged area stops contracting properly. The heart's pumping power weakens. This can lead to irregular heartbeat, arrhythmia, cardiac arrest, sudden collapse. Why immediate treatment matters. The faster the artery is opened, the more heart muscle can be saved. Doctors may give clot-dissolving medication, perform angioplasty, inserting a balloon and stent, restore blood flow. Every minute matters, because once heart muscle dies, it does not regenerate like skin. Your heart works for you every second of your life. Understanding what happens during a heart attack could one day save your life, or someone else's. If you want to keep uncovering what's happening inside your body, subscribe to Anatomy Uncovered, because the more you understand your body, the more power you have to protect it.